Welcome to today's talk on PANS and PANDAS, an integrative approach. And so for some of you, you might be thinking, PANS, PANDAS, what are you talking about? What we're talking about is pediatric autoimmune neuropsychiatric disorders. And PANDAS is an autoimmune psychiatric disorder related to strep, and PANS is an autoimmune disorder related to other infectious agents or toxicities. And these are autoimmune encephalopathies. And so essentially brain on fire. And these things occur primarily in the basal ganglia and primarily in children. So what we're going to discuss today is exactly what that means and what it is, symptoms, testing that we can utilize, myths surrounding these conditions, and underlying causes for these. But before we get into that, for those that don't know me, my name is Dr. McLaughlin, and alongside my wonderful wife, we run Aquarian Integrative Health. And because of my wife's health journey and because of how we viewed the health landscape, especially in the last decade or so, we wanted to do something different. We wanted to provide people with healthcare that you deserve, giving you real answers and real solutions. And we wanted to revolutionize healthcare one person at a time by providing a comprehensive system of diagnosis and integrative treatments that foster lasting health and wellness. For us, true healing comes from repairing all levels of our health. And what I mean by that is our biophysiology, so our anatomy and our physiology, our bioenergetics, or our nervous system, and our consciousness, our thoughts, feelings, emotions, and spiritual connection. And to me, only when we repair all of these things can we get true lasting healing. We also believe that we're inseparable from our environment, and our environmental inputs can make us healthy or they can make us ill. And at the root of all conditions, there is an environmental component to it. A big part of healing and creating a healing environment is getting back to the forces of nature that create healing within us. We started Aquarian Integrative Health because we viewed there was clear voids in modern healthcare that needed to be addressed, whether that's over-specialization in medicine. And with PANS and PANDAS, you can see that with psychiatric diagnosis, with no digging deeper and looking at underlying causes and autoimmune issues and infections and toxicities that can precipitate psychiatric diagnosis. There's a lack of understanding of basic physiology in medicine and how, in the case of PANS and PANDAS, how infections play a role in brain pathology. So infections other places in the body and how they can end up in the brain. There's an overemphasis in biochemistry in medicine. We are electromagnetic beings, and so many of our interventions have to be centered around the electromagnetics of the body and restoring that. There's a lack of understanding of circadian biology in allopathic medicine and alternative medicine. So it doesn't matter what pharmaceuticals or supplements or things that we take, if there's environmental mismatches in our lives, we're staying up late with lots of lights on, we don't get sunshine, we don't get outside, all of these things, that will precipitate illness. And we can't outpace that with supplements, with pharmaceuticals and those kind of things. Big problem in medicine that drove me nuts for years was the inability to find the actual primary causes of things. And what this involves is leveraging better testing, which we utilize. So we utilize blood work, we utilize functional labs, we have specialized technologies in our office where we can get a very clear picture of what's going on with somebody and what needs to be done by understanding what the primary drivers of their illness are. And that's unique for everybody. And one of the big things too is this one size fits all killing spree component. And especially in PANS and PANDAS, a lot of physicians will say, it's just an infection. Let's just give high dose antibiotics. Let's give high dose antimicrobials. And that doesn't always work. And that doesn't always work because we're not taking into context the whole patient. We're not taking into context circadian biology, and we're not fully understanding what's going on with the physiology of a human. So when we can do all of those things, we can get customized approaches to healing and wellness. The promise we make all of our patients is that we find the primary cause of our health problems. And that involves us digging really deep and uncovering everything through different types of testing, through very extensive case histories. We go very deep to really uncover the true root of illness. And once we've done that, we work really hard and alongside the patient to help them achieve optimal wellness. And in doing so, we have your back through the entire process. What we witnessed with people coming in from other physicians or people struggling with their health over the years is a lot of times people are told, okay, this is what's wrong. Just take this and you'll be fine. And they're left on their own. And for us, we wanted to provide a space that allowed people to have constant contact with us, that allowed people to have support with us on a continuing basis. And because we do those things, we can create lasting changes in people's health and wellness. And for us, really what it's about is true lasting health. Because I believe that once we are healthy, truly healthy, that opens the door to so many beautiful things in life that we're not afforded unless our body, mind, and spirit are healthy. Let's get back to autoimmune encephalopathies and exactly what's involved in PANS and PANDAS. Like I alluded to, PANS and PANDAS are autoimmune disorders that result in basal ganglia encephalitis. And these are primarily triggered by infections and toxins. And it's important to know that at the root of all autoimmune conditions, whether it's PANS, PANDAS, whether it's autoimmune thyroid conditions, whether it's autoimmune gut conditions, there is an infection or a toxicity in the tissue not identified and an environmental mismatch. Now, this is becoming an overwhelmingly large concern as time has gone on because right now in America, 1 in 200 children have a diagnosis of PANS or PANDAS, and that keeps growing every single day. And boys are 2.5 to 4.7 times more likely than girls to develop this. And both of these syndromes involve neuropsychiatric changes that are triggered by toxins and infections. And what we'll see is what happens is kids can be functioning and going on and developing normally. And then literally overnight, something switches and their brain becomes on fire. And it creates all of these challenging changes in a growing mind. And when we're talking about PANDAS, that is specific to group A beta hemolytic strep. Okay, so this is a strep infection that has made its way into the brain and is now causing neuropsychiatric problems. And this is a very important study that I wanted to show to you. This was over 1 million kids under the age of 18. And kids with a positive strep test had an increased risk of mental disorders after they had gotten the strep infection. And a risk of any mental disorder, OCD, or anything like that is more elevated after a strep infection. And so I think this is a case, one of those things where kids get strep infections and all these other things, and then neuropsychiatric things develop. It may not always be full-blown PANS and PANDAS, but we have to take notice of these things in our children and the people around us to see all of these mental things developing, these psychiatric things developing post something as seemingly innocuous as a cold or a flu or a sore throat. Really what happens with this is the immune system functions abnormally and starts producing autoantibodies. These not only attack the microbes that are in the brain, but they begin to start to attack the receptors and other targets in the brain, primarily in the basal ganglia. And what's happening is the immune system sees the similarities between normal body tissue and a particular molecule. In the case of PANDAS, it's strep, and in the case of PANS, we'll get into it, but it's a couple other things. And then mistakenly attacks the body tissue. And this misguided attack leads to a tremendous amount of brain inflammation and a sudden onset of symptoms. Unfortunately, because of the neuropsychiatric symptoms, children with PANS and PANDAS are often misdiagnosed as having some kind of psychiatric illness. And this often leads to a psychiatric drug treatment to manage the symptom. But this is a huge problem because this doesn't address the primary cause. And the primary cause is an infection triggering the autoimmune inflammatory condition. If you've been listening to this and you understand that PANDAS is caused by a strep infection in the brain, the natural conclusion is, all right, we just kill the strep. But the problem with that, even in a diagnosis of PANDAS where strep plays a role, it's probable that the strep infection alone isn't the culprit. And more than likely, the strep infection is just the straw that broke the camel's back. This is because, unfortunately, there are too many pathogenic and toxic threats coming at all of us each and every day. And especially for our children, their small bodies cannot handle the onslaught of chemicals and toxins and heavy metals and all these different things. And even the medical community at large has recognized this, and because of that has expanded out the criteria for PANDAS into what they call PANS, and acknowledging that these neuropsychiatric syndromes and symptoms are caused by more than one thing. And so there's an infectious agent, and that can be Lyme disease, it can be Babesia, it can be Bartonella, or a mycoplasma infection, it can be from a Coxsackie infection, or a retroviral infection. And even this can be precipitated by environmental problems, whether that be from man-made EMF, like cell phones, cell phone towers, Wi-Fi, all of these things. Glyphosate, so the pesticides we use on our lawns, pesticides we use on our food, mold toxicity, heavy metals, or parasites. And the reality is, for people that we see in our office and for the kids that we see in our office, it's always a constellation of all of these things, right? We are brilliant, beautiful, healing machines. And if it was just any one of these things, generally we'd be okay. We get into trouble because we're constantly being bombarded with all of these things, and our environment has changed so much in the last 10 years that we have outpaced our ability to respond to our environment because our food is toxic and we have tremendous amounts of EMF and our homes are toxic. That sets the stage for other things. And this goes into what I always tell people is you're allowed to have more than one thing wrong with you. I think especially when it's our children, but even in us, when we've been struggling with something and we finally feel like we've got an answer, right? Oh, it's the strep in my brain, or oh, it's this, or oh, it's that. That can be true, but there can be other things going on, which is why we do such comprehensive testing to see not only what the toxins, infections, and other things are going on in the body, but what is the organ function like? What are our detoxification systems doing? What is our drainage systems doing? All of these things together forms the context of the person, which allows us to make better decisions. And true PANDAS, the diagnostic criteria that's out there right now, is the presence of neuropsychiatric symptoms, primarily OCD and or tics, and usually starting at 3 years old to somewhere in puberty. And this can be either an acute sudden onset, which we've seen, or it can be episodic when it comes and goes. There's usually always other neurological abnormalities as well. And again, it's a group A strep association. And I say association because strep may be the bullet, but there's always other things that loaded the gun. And this can be other infections, this can be other toxicities, this can be structural abnormalities that are preventing the body, especially the brain, from healing properly. These can be other environmental contaminants that we have to look at. And really what this looks like in kids is ADHD, aggression, brain fog, hyperactivity, tics, OCD, separation anxiety, sleep disorders, even up to rage outbursts and suicidal ideation. And when I talk to parents, all of these things are quite common in kids, unfortunately, especially now. And they may only have a handful of these, they may only have one or two of these, but all of our children and us are just being bombarded with so many things that our brains are all inflamed. And usually what happens with kids when I talk to their parents or when I talk to them prior to getting a diagnosis of PANS or PANDAS or prior to an onset of all these symptoms, the child has chronic sore throats, repeated ear infections, repeated doses of antibiotics. And they always say, oh, my kid is always sick, right? And when that's going on, that shows me that there is acute and chronic infections that are constantly being precipitated in the child's body that can make their way to the brain. And the thing with antibiotics, especially repeated doses of antibiotics, people don't understand is antibiotics are mold-based. So one of our biggest exposures to mold is through the use of antibiotics, especially repeated doses. And so this sets the stage for a child that's going to be prone for brain inflammation, going to be prone to consistent infections and all these different things. Now, one of the biggest things is I know the diagnostic criteria for PANDAS is 3 to puberty, but this is a huge myth that this can only occur in children. And this is Dr. Goodman. He's a psychiatrist based out in California, and he's one of the leading PANDAS experts from the psychiatric side of things. And he says, I've treated childhood, adolescent, and adult PANDAS for over 20 years. While the disorder is acknowledged in children and adolescents, its occurrence in adults is denied. It's as if something magically goes away at the age of 18 and cannot occur, reoccur, or continue. And this is absurd. And to compound the contorted reasoning is the assertion of some academics that PANDAS is very rare, another faulty bit of thinking. And so right here, not only in my clinical experience and other colleagues, but from the psychiatric side of things, someone who's been dealing with this for 20 years who sees it consistently in adults. And even since they've broadened out the diagnostic criteria into PANS, Category 4 of PANS has no age requirement. Usually what this looks like in adults is they'll say, I was sick all the time as a kid. I was on a whole bunch of antibiotics when I was a kid. I had chronic ear infections, chronic throat infections, all these things. And when we fast forward into them being adults, they have mental health disorders, they have severe brain fog, they have memory loss, they have poor word recollection, they might have bipolar or other neuropsychiatric diagnoses to go along with this. I wanted to just showcase this for you guys. This was a patient that we had, 60-year-old female, history of repeated antibiotic use from childhood throughout into adulthood, always gets sore throats all the time, brain fog, all these other neurological issues and neuropsychiatric problems. And as a part of our comprehensive diagnostics, we always run for these types of patients, we run strep titers in their blood work. And so these two are sky high in an adult who's had all of these things. And our other forms of testing that we leverage also showcase that there was strep in the tonsils, so there was strep in different parts of the brain. And so we can start to formulate these things together. But I just wanted to show this to you that even adults can have autoimmune strep conditions that are showing up as neurological neuropsychiatric problems. And so when we're thinking about testing, I always put this caveat in, is when we're doing blood testing, and this is why blood testing is just a fraction of the types of testing that we utilize, is blood testing is a snapshot in time. And so we have to correlate all blood testing and all testing with presenting symptoms, with physical exam, with different types of advanced diagnostics, and most importantly, the context of the patient to build out a full understanding of what's going on with that person and the steps we need to remediate these things. A big importance is the difference between disease values and optimal values. So many times, even when we're looking at antibody titers and stuff like this, is if it's one below what's acceptable or too high, or one above what's too low, they'll say, oh, you're fine. When that's not the case, right? So we have to look at all of these things very carefully. And so when we're talking about testing, just the real bare bone basics for PANDAS patients, We want to do a complete blood count, or we want to do a metabolic panel. And this will give us some insight onto how the immune system is functioning. And in particular, we want to pay close attention to the lymphocyte and neutrophil ratio, or types of white blood cells. And so when lymphocytes are greater than 60% of the neutrophils, that usually suggests there's some kind of autoimmune process going on in the body. And all of that means is there's some kind of infection or toxicity or environmental mismatch that is skewing the immune system to start attacking its own cells in the body. And then the most important thing is a physical exam, actually examining the sinuses, the tonsils, the oral cavity, the eustachian tubes, checking to see if there's any head injuries in the past, looking at the lymphatic system, all of these things, and taking someone through a real physical exam, believe it or not, does not actually happen most of the time. So if we see inflammation in the tonsils, if we see chronic inflammation in the ear canal, in the mouth, all of these different things, we have to rule in or rule out what exactly that is. And then basically looking at streptococcal titers. So anti-streptolysin O and anti-DNase B are the two things that we utilize on basic blood work that we get everyone to do, just to look at these things. But that's only part of the picture. So we've figured out that there might be something going on, could be attributed to strep, could not be, but we need to dig deeper. And so when we dig deeper, one of the things we always look at is KPU, and that's pyroluria. Basically, what that means is if someone has this, their ability to normally detoxify is very limited because they're releasing superphysiological amounts of B vitamins, of zinc, all of these things, and they're not actually using them for cellular processes, especially for detoxification. And so this alone requires an adjustment in diet, requires some supplementation, because this is an acquired thing that doesn't go away on its own. And then we have to rule out or rule in any kind of tick-borne illness. So we use different types of tick-borne illness panels from different companies that are very good at picking up Borrelia, Babesia, Bartonella, all those things. Mold testing is very important as well. Heavy metal testing is important. And then we also do the Cunningham panel, or what's now called the autoimmune brain panel, to look exactly and see what kind of autoimmune processes are going on in the brain. So if we have an infection or we have a toxicity, is it creating an autoimmune process in the brain, and what tissues are it selecting? And that will help us figure out from a therapeutic standpoint what we need to do. And then in the office, we use our bioresonance testing to really pinpoint down exactly where things are. So where these infections are. So when we do functional line panels, mold panels, heavy metal testing, it just tells us that's where it is. And it's either showing up in the urine, in the stool, or in the blood, but it doesn't really tell us where things are. So that's why we use the bioresonance testing to figure out exactly where that stuff is, down to the DNA level. And then we use autonomic response testing to really fully customize and tailor our treatment programs. So what does the person need exactly? The biggest thing is when we're talking about medicine, we're talking about interventions, we can have a good diagnosis, but the treatment options available, whether they be pharmaceuticals or supplements or whatever, are not tailored to the person. And when we can leverage autonomic response testing to do that, we get exactly tailored treatment programs for the person and the individual. And so all this being said, most of you probably think, okay, we may not just go in and kill the strep, but let's just go in and kill all the microbes and the brain will be happy. This is the traditional line of thinking. And unfortunately, this doesn't really work in my experience. And it doesn't work because oftentimes we have to improve the terrain first. Because if we go in and try and clean up everything or get rid of all the microbes and there's no efficient way for them to get out, then oftentimes, especially in children, it will exacerbate their symptoms. And this comes down to a couple reasons, but unfortunately, most of us are undernourished and overfed. So we don't have the key mineral and vitamin cofactors to allow for proper detoxification. And most of our detoxification pathways are overwhelmed and overburdened. And so if we're just trying to kill things and hope the body sorts it out, but we haven't cleaned up the terrain first and we haven't opened up all these drainage pathways, then we're going to run into real problems. And that usually means exacerbation of symptoms. Another thing we have to do is fix the diet. And so when we're talking about brain inflammation, specifically with PANDAS and PANS, if I'm eating things that are causing brain inflammation, then I'm going to create 2 steps forward and 1 step back. Okay. So there's a lot of artificial dyes, artificial flavors, and preservatives that can cause a whole host of brain problems. And in the context of a normal child or an adult, we may not fully notice these things, but in children who have PANS or PANDAS, so they already have an ongoing autoimmune condition in their brain, they don't have as much buffer room to deal with these other toxic insults. And so we have to opt for a whole food, organic, phytonutrient-rich diet. So things that are going to calm inflammation, like berries, ginger, raw honey, specific use of different herbs like oregano and thyme and garlic and these kind of things. Another big thing is microbes thrive where there are chemical residues. So we have to think about cleaning up the terrain of the body in general. That can start with food. And then we have to think about, are there chemicals in the body that are causing microbes to thrive? Because if we just keep trying to kill microbes and they keep coming back, let's say with strep, that's because there's other toxicity in the body that's precipitating the growth. And so pesticides, especially glyphosate, allows strep, E. coli, and Clostridium to grow in the oral cavity and digestive tract while killing off our good bacteria, like our bifidobacteria and the lactobacillus. And so if I'm constantly exposing myself to glyphosate, especially with food, then I'm going to have a problem with strep, especially if I already have a problem with it. And the other thing too is fluoride damages our oral microbiome. So we have to strongly consider the water we're drinking and the toothpaste we're using. Because if I'm constantly insulting my oral microbiome and my tonsils, which are very close to my brain, with all these chemicals that are allowing strep or other microbes to grow, I'm always going to be 2 steps forward, 1 step back. So once we've done those things, then we have an opportunity to open up drainage pathways. And really what happens with a strep infection, so we get a strep infection in our oral cavity or our tonsils, and it moves. If it goes to the brain, it's because it moves into our lymphatics and into our blood vessels, and then eventually into the brain where it wreaks havoc and causes these autoimmune conditions. What we have to do is clean up the blood, and we also have to improve lymphatic drainage. And this can be interventions with supplements, but this can also be interventions with sunlight, with grounding, with movement, with specific drainage techniques. All of these different things that we utilize become very important. And once we've started to open up these pathways, clean up the terrain, fix the diet, we can start thinking about bringing down the neuroinflammation. And sometimes we can do all of these things more or less in the beginning together. And when I'm talking about neuroinflammation, I'm talking about the microglia. And because 2/3 of our brain's immune system is glial tissue, and 1/3 is what we consider neurons. And the microglia are the things that get rid of the excess debris or microbes or things in our brain. And the problem is, if I have continued infection in my brain or a microbial imbalance in our brain, the microglia get very excited and they end up contributing to inflammation. And so what we have to do is modulate that response. And we can utilize things like curcumin, utilize things like ginger and other bioflavonoids that help modulate the microglia so they can do their job, but they're not going haywire. And then we also have to modulate excessive mast cell activation. This really centers around controlling our EMF environment. And some of you may have heard of something called mast cell activation syndrome. That basically means there's a part of our immune system that becomes hyperactive and hyper responsive to everything, the foods we eat, supplements we take, everything. And this is in large part due to man-made EMF exposure. And this is especially true for children because children don't have, one, the bone thickness and neuronal development to withstand some of the negative effects of EMF. And so one of the biggest things we can do to control neuroinflammation in PANS and PANDAS, but in any other brain inflammation conditions, is really careful use of cell phones, of Wi-Fi, and strong considerations that these things shouldn't be used that much, especially in kids. I love to use this analogy because it's gross and people get it. And so all of this conversation about cleaning up the terrain and opening up the detox pathways and all of these things, before we get into dealing with any of the microbes, it's very similar to if we leave the garbage out at the end of our driveway and it starts to pile up, we just keep throwing it on top because the garbage men can't get to our house because the roads are closed or the weather's bad. And then all of a sudden we get rats. If we go out and we set rat traps and we try and kill all the rats, it doesn't change the fact that we can't get rid of the garbage. And once we start getting rid of the garbage, so we fix the roads, we allow the garbage men to come, we don't deposit more and more garbage because we've cleaned up our ways, then the rats will go away. And so often in medicine, we're worried about the rats, but we're not worried about the garbage. And we always have to consider both, but the biggest thing is we have to deal with the garbage first. At this point, now we can eliminate the underlying infectious agents because the body is now able to do. And for us in our office, when it comes to PANS and PANDAS, we use a combination of antimicrobial compounds, different herbs and vitamins and minerals, and low-dose immunotherapy to, one, rid the body of the infection itself, whether it be from strep, whether it be from Lyme, whether it be from mold, and modulate the overactive immune system responses that trigger the inflammation and neuropsychiatric symptoms. And this is a key component, which is why we do the immunotherapy, because even in the absence of the microbes, a lot of the times our immune system becomes so sensitized that it starts to trigger inflammation from an immune system component, even if the microbes are gone. And so when we do something like this, we always have the antimicrobial compounds combined with the low-dose immunotherapy to, one, lower the body burden, and then two, reestablish normal immune system tolerance. And when we're talking about strep specifically, I know everyone's probably thinking we'll just take antibiotic. The reality is, and this is a sad reality for many infections now, because of the liberal use of different types of antibiotics over the years, many of these microbes have become antibiotic resistant, and that includes strep. So most kids with PANS and PANDAS have a history of using antibiotics, and it still didn't remediate the issue. Most adults with PANS or PANDAS have a history, a very long history of using antibiotics 4 or 5 times a year for many years. And so for us, we have to look other places. And two compounds that I wanted to highlight that work very well for strep-based infections, especially in the brain, is lactoferrin. And lactoferrin is a specific glycoprotein that's antibacterial, antifungal, and antiparasitic. So when we think back to what can cause PANS, these neuropsychiatric symptoms can be caused from strep bacteria, can be caused from mold, can be caused from parasites. So when we utilize things that can attend to all of these things at once, one, people have to take way less things, and two, it's far more effective generally. And the most important thing with lactoferrin is also immune modulating, and it's extremely neuroprotective. So rather than just taking something that's going to kill, we can take something that's going to modulate the immune system in a more productive way and actually protect the existing brain tissue. And propolis is something we use heavily with a lot of PANS and PANDAS patients. It's a component of bees and what they use to create their hives. And the beautiful thing with propolis is it's antibacterial, antifungal, and antiparasitic, just like lactoferrin. And it has tremendous immune modulating properties. So like I said, a lot of people will come in not just with strep or not just with Lyme or not just with parasites or what have you. It's a constellation of a number of things. So when we're looking at things to utilize to overcome these things, there are things in nature that are very helpful. And they're helpful because they can attend to a lot of different things and help the immune system in a positive way, rather than just going in with antibiotics or other types of herbs that are just going to try and kill. Another huge myth with PANS and PANDAS, and quite frankly, every autoimmune condition, is the environment doesn't play a role. And that's just simply not true. And what if there was a substance that was a potent antimicrobial, reduced the formation of reactive oxygen species, promoted detoxification, protected against mitochondrial damage, acted as an antidepressant, was neuroprotective, and alleviated depression? That'd be pretty cool. Even cooler, what if we produced it in our own bodies? But our daily habits limit the ability of it to be produced and to be released. And by daily habits, screen time, by daily habits, blue light at night, all of these things limit this beautiful compound's ability to do all of the necessary things that it's designed to do. And this compound's melatonin, in case you guys didn't guess. Melatonin is incredibly vital to our brain health. And when we get too much light at night, when we don't honor our circadian biology, when we have excessive screen time during the day and not enough sunlight during the day, melatonin can't do its job, and we lose these beautiful neuroprotective effects. So again, in kids or adults with PANS and PANDAS, we have to strongly consider balancing our circadian biology in addition to doing anything else. And in fact, a lot of times this is the most required thing. However, this is the thing people are most recalcitrant to do because we've become accustomed to watching TV at night. We've become accustomed to being on screens all the time. We've been accustomed to all of these things that disrupt our melatonin. And so under normal circumstances, this time of year being late summer, sun sets between 7, 8, maybe 9 o'clock, depending on where you are. And then 2 to 3 hours after the sun sets, our melatonin starts to kick in, and it acts on specific parts of our brain to allow for deep sleep, to allow for detoxification while we sleep, to allow for neuroprotection, immune modulation, all these beautiful things that it does. However, when the sun sets, if we get a lot of blue light exposure at night, whether that's from iPhones, iPads, TVs, lights in our rooms, lights in our homes, that disrupts that melatonin release. And so melatonin only kicks in again 2 to 3 hours later after darkness. And so what happens is instead of getting it from 11 until we wake up, we're only getting it from 3 to 6 and sometimes less. And so our environment and our light environment completely shapes our brain health. Okay. And so this is a massive thing that has to be considered because we can't get well in the same environment we got sick in. It's just the reality. And that could be the home we live in. That could be the place we live in the world, but always it is our light environment. So if we have a bad light environment, we will get ill with something because the lack of melatonin leads to immune system dysregulation. The lack of melatonin allows for excessive brain inflammation. The lack of melatonin decreases the brain's ability to detox, all of these things. So we have to change our light environment in order to get well. The body is a dynamic system that's designed to keep us healthy. And so when there's a problem, there's a reason for the problem. And in the case of PANS and PANDAS, these neuropsychiatric symptoms are a warning sign that there's something deeper going on, whether it be an infection, a toxicity, a strong circadian mismatch. All of these things are leading into these neuropsychiatric symptoms. And until we get down and really figure out what's going on and how to remedy those things appropriately, we will continue to have symptoms. And so I think we owe it to ourselves to get to the bottom of it. And as parents, we owe it to our children to allow them to be as happy and healthy and develop as appropriately as possible. And for adults, if we've struggled with brain fog and mental issues and neuropsychiatric stuff for our whole lives and just put on medications or told it's not a big deal or all these things, we owe it to ourselves to dig a little bit deeper and try and figure these things out. And for us, this is the biggest difference between us and other functional medicine or allopathic medicine is we have the ability to leverage all of these different tests. We have the ability to leverage all the different technologies that we utilize to give people a very clear picture of what's going on and then build out a roadmap that leads to a healthier body and a healthier mind so that people can have long-term and lasting health, rather than getting stuck on the rabbit wheel of you do something for a little bit of time and then something else comes up, you do something else, and you're just always precipitating these things, which we see all the time. People come in their 30s, 40s, 50s, and 60s, and they've been sick since they were kids, just on and off in different starts. And it's because at those beginning stages, people didn't set them up for success because they didn't dig deep enough. They didn't go through all of the things that were required. I really sincerely hope if you are struggling with PANS, PANDAS, or you think your child is, join us in revolutionizing your health of your children, of yourself, of your family. And I welcome you to book a free consultation with us. You can do that on our website, Aquarian Health Solutions. You can do that via email, support@aquariansolution.com, or you can text us anytime, 689-219-6979.